So I can tell everybody's anticipation growing as we kind of had to tease here. Just brace for impact, everybody. As Matthew hears all this, as we have to give him an announcement as we do the call in. So I am going to bring in our friend of the show, Matthew from
Hey guys.
Ohio. How are
Hey
you?
Welcome back.
Josie. Hey Ben. Hey, doing all right. Um,
Doing
Honestly,
good.
I was actually I was I was actually gonna take a break, but then I saw your guys' title and I was like, I really wanted to kind of get into that. I do wish the people who leave comments on the shorts would call in. There's a lot of people on the shorts that leave comments that have good points. I mean, I'm sure they want to be helpful too. Maybe they just don't know how. So I would love for them to call in as well. So I guess I'm on double duty until they call in, I guess.
Yeah.
But yeah, so I had this question of, so I was thinking when I saw the title, I was thinking about Richard Dawkins and how he kind of goes against this idea. You guys probably would consider him anti-trans. Am I correct in that?
Yeah, for
Yeah.
the most part. Yeah.
hmm And so what makes someone like him anti-science?
No, that position he has is anti-science.
hmm
And you can be a brilliant
So,
scientist and have really shitty
mhm.
views about certain things, and that is something that he has decided to not study well and not think about well, and he gave into kind of the misinformation. Like when we say anti-science, like
Mhm.
we're not saying that I wouldn't say his every position he has is anti-science, but that one is.
Mhm.
Hmm.
And
Yeah.
why would you say it's anti-science?
Go ahead,
I
Ben.
would
I
s-
think you're more familiar
yeah,
with the comments.
yeah. So let
Pardon?
me ask you, Matthew, how did you arrive at your position of I guess I know your position fairly well by this point, but can you repeat your
Mhm.
position to the audience?
Well, in the beginning, my position was just like anybody would be like, oh well, that doesn't seem right. Even though like I feel like the pro-trans tries to make it seem like, oh, this has always been a thing, but like if you're kind of putting your mind in your brain in your head, you're like, no, this is not right. So that was my first kind of thing. I was like, this is not right.
So
But
if
then
I
I,
gather,
had conversations with
so
you
if
guys. Pardon?
Well, so if just based on that first statement, that already tells me a lot
Mm.
about how you arrived at your position. But that was going to be my next question: is
No, no,
how
no.
how did you
Yeah, yeah,
arrive? How did you arrive at your position?
yeah, yeah. No,
Like it
no. So
sounds
this
like
was the
you
beginning,
used
right?
intuition. It sounds like no, but Matthew, it sounds like if that's where you started, like that's where your
Yes.
statement started was the fact that you put your brain in your head and you thought about it. So you had some intuition. You had this feeling that something
Yeah.
wasn't right, and then you made your position. Does that sound right to you?
Mm, no, not exactly. So let me
Okay,
finish.
what else
At
what else
first,
did you use? No, what like I'm asking these questions for a reason. What else did you
yeah,
use
I
to
got you.
arrive at your conclusion?
I got you. So at first, that was where my mindset was, right? So I decided, let me look into it. Let me spend some time with ideas that are not my own, that are pro-trans and all this stuff. And so, I would think I don't think my position has changed, but I think my position has been confirmed. And that doesn't mean that
How so?
that
Like
I'm
what
just
did you read?
yeah,
What did you read specifically that
yeah.
like reaffirmed your position?
Right. So I actually took two sides. I read I think it was Helen Joyce's book. I'm sure you guys are familiar with her book. I can't remember the name of it.
So that's
Trans.
not research. So that's not research,
Hold
right?
on. I'm not.
That's not.
I'm just telling you
That's a
what.
put.
I'm just giving.
Okay, well,
I'm just
I'm
giving
I'm
you what I've read.
evaluating. I'm
I'm giving
evaluating.
you a list.
There's a reason I'm
This is
asking you
a
the
list.
questions.
hmm
Yeah. Okay. Give
hmm
me the other things on your list.
Yeah. So are
So you
you
got that
familiar with
book.
Helen Joyce's book?
I am. It's not research. It's a
Okay,
book that a
that's fine.
person
And so
wrote.
after that, I listened to Turbin, Jack Turbin. I
Okay.
think
So
Josie said
again,
they worked with
yeah.
him.
So he's
What?
Yeah, I am familiar with Jack Turbin. What
Yeah.
how did what he said contribute to affirming your position?
Right. And so I also read an article on the
No, answer my
from the
question.
APA
How
called,
did no?
pardon?
How did what Jack Turbin said reaffirm your position? Because he
Oh,
would
okay.
adamantly disagree with
Mhm.
you.
Yes, of course. It's just when he was expressing like gender affirming care and stuff like that, it seemed like it was more of like when people say it's scientific, it's saying that it's giving them a better quality of life. But just because somebody has a better quality of life in something doesn't mean that it is necessarily good for them or
Matthew,
society.
did
Like
you
they may have a better pardon?
Matthew, be quiet.
Yes,
What I'm
yes.
getting like what you're telling me tells me a lot about how
Mhm.
you arrive at your conclusions. Because every time
Okay.
you brought up a source that number one, you went into this with a bias already, and you were out there to confirm or deny your bias instead of what science does. Science enters with a question. It doesn't enter with a stance. It enters with a question and says, "What is this question?" And then you
Mhm.
make a hypothesis based on what you already know and say, "Okay, I would guess based on my prior knowledge that this would be the outcome if I did this experiment." You do the experiment, you get results,
Mhm.
you evaluate and you say, "Did this like answer like how did this answer the question?" And uh with regard to a null hypothesis, if that one was used, does this change what we already knew? Does this change what we're already doing? That's the
Mhm.
scientific method, right? What you're doing
Mhm.
is not the scientific method. You're starting with a
Okay.
bias. You're using your intuition and you are saying, well, this sounds good to me, or this doesn't sound good to me. Not once in any of your references did I hear an academic paper, an academic. Well, I know you were getting into something about the APA, but the way you're
Yeah, I was
evaluating
giving a list.
these, what
I was
the
giving a
what you're
list.
taking from these, no, but even no, regardless of what sources you use, the fact that
Mhm.
you didn't address like the data that they're presenting, you addressed how you feel about what they said, which is not an academic evaluation of what's being said. That does not tell me, number one, if the source was legitimate. It doesn't tell me what specifically it did to your perspective. Like if Jack Turbin has a lot of
Well,
things that he
I would
says.
have to be able to speak in order to do that, Ben.
Okay. Well, here's the thing though. You want to go on a monologue, but if you were presenting scientific information or coming at it from a scientific perspective, I would expect that your first reasoning would be data centric and not intuition centric. And you kind of failed to do that. And so I'm trying to not let you just throw out a bunch of like phrases before we
So
address and debunk some of this. But if Jack Turbin is a board certified psychiatrist, like child and adolescent psychiatrist,
Mhm.
he has there's a lot of data that he presents. And if you brought
Correct.
up some of the data and you said, I disagree with this point because here's this data, here's this p-value, etc., we could have more of a discussion. But intuition is flawed. It is so flawed because
So,
you can rely on whatever you think you know, but there's always information that you don't know. And you need to be able to account for, maybe I don't know enough to make a final assessment on this, and I should rely on the data. And so I question
Josie,
when I
Ben.
say, no, and here's the where I'm getting with this, Matthew. When we
Okay.
say something is anti-science,
Mhm.
like the position, though, what you have to do to arrive at a position that opposes trans rights, you can't go through the scientific method like we've been doing and arrive at that. And
So,
that's what
Josie,
we're
Ben,
suggesting.
yeah, I think the three of us, we've all served in the military. And when
yes.
somebody disseminates data, right, you use that data to make a decision, right? So Jack
Right, but
Turbin,
who
even Helen Joyce, even
right,
Helen Joyce
Matthew,
and
but
Jack
there's a
Turbin
difference.
and the APA, pardon, um,
No, but
Just
there's a
give me one moment,
difference
please.
in who is
Okay, go
there's
ahead.
a difference in who is taking that information and who is doing what with it. Matthew, like, not to
Mm-hmm.
be insulting, but you have zero background in medicine, so why should your intuition factor at all into how we're caring for trans people medically? Like, we don't give it I
Right.
personally don't
So,
give a shit about your opinions. But because what happens, especially with
okay.
what psychiatrists are saying and what the APA is saying, and all these medical boards are saying, their audience is the medical community, right? So there's an assumed baseline knowledge that you have that they're talking to. So they're assuming you went to medical school. They're assuming you had like some residency training, possibly fellowship training. There's an audience that's different there. It's not for people who had a third grade level of science education to say, oh, yeah, just build on that. No, they're making some assumptions. And I'm sorry, but you have some work to do to have that basic knowledge to then be able to apply the things that some of these specialists are saying.
So
So,
I'm assuming you're assuming my education, which is fine. I don't really care about that. But the APA is not expecting me to. This is for the general public. It's not expecting me to be a
right,
med
their
student.
the general stance of saying that something is like safe for general guidelines and here are general guidelines, that's fine. But a lot of like the more nuanced things that like you try to get into are not necessarily directed at like a general audience.
Yeah.
Well,
So
So
anyway, I'll
Matthew,
depending
I
on
let
what
want to
I
Justin
jump in.
receive. I mean,
I
yeah. I
just
mean,
want to
you guys
jump
can
in.
go ahead and talk. I guess that's what's going to happen here. Go ahead.
No. I haven't had a moment
That's
to
fine. That's
speak
fair.
here
That's
because
fair.
I just want to just say, okay, so the going back, and I'm going to use some of the meta conversations that we've had in the past, about one of the statements that you said is that you come in, you have a conversation, and we reaffirm your position, and it's like you use our conversations to kind of reaffirm your positional stance, right? And so when
Not in
I'm
my
thinking,
mind. I'm talking about generally. I'm not talking about in my mind. I'm talking about generally. Yes, last week we had a conversation that if the public was to see that conversation is exactly what I'm talking about. At the end of that conversation, you guys are saying, don't worry about or you shouldn't be so concerned about your own comfort. And I was like, that is exactly my point. Your own comfort should not be affecting other people. And you guys basically made the point
and
that I
it's
was
not
making is what I was trying to say.
it's not Matthew, and
so
that's a garbage point that you're bringing up because like what I do to my body should not like you should not have control over that. And that's what we're saying. Like and what you're
Should
saying
you have control of whatever
is
I do with
that
my mind? If I said, if I define you as a
no,
female,
Matthew,
is that a problem?
these are opposite things.
hold on.
You are like what we are saying. I want medicine to make me happy in my body, and
Okay.
that's different. My saying that I am comfortable with me and you don't need to be comfortable with me is a totally different position from what you're saying. You're saying you should change your body because that's what I want it to be. Do
Yeah.
you
Not at
see how
all. No.
different that is? Do you
What
see
I'm
how no,
saying,
that is exactly what you said. That is then
So
then how are trans people causing you discomfort and why should that matter to us?
okay, so should I be required to call you he, him when I know that you're a female?
You're not required
wait,
to, but it's an asshole
yeah,
move if you
Okay, then
do.
that's fine. Then I'm
we've
fine with
already
that.
We've addressed
we've
that
already
Exactly.
down that
many
road.
times.
We've
So this is
addressed
not the
that last
conversation I
week.
came to have. This is not the
Okay,
conversation I came to have.
I understand, Matthew, because right now,
Mhm.
I want to I want you to be able to state your argument because
Yeah.
I want a moment to be able to speak on this. So you say you do not believe that anti-trans equals anti-science. Now I want you
Correct.
to prove that to me right now.
Like I said, I just don't see, you would have to show it to me how it is because I'm saying it's not. I am unaware of the fact or the quote fact that is anti-science. What about it is
So
scientific?
okay, I'm both Ben and I are both trans people who have scientifically medically
Mhm.
transitioned. How is that anti-science?
So scientifically, medically transition.
Yes.
I'm not necessarily saying your position is anti-science. I'm kind of saying how is my position anti-science?
Because somebody would say that what we're doing is wrong, even though we are scientifically, medically transitioned as trans people. There are people who say that what we are
Mm-hmm.
doing is wrong because we are affecting our biology. We no longer can have children. People say that all the time. People try to
I
say
gotcha.
what we are
Well,
doing that is scientifically valid and proven to support our ability to live happily and thrive as trans people is wrong.
was it right to drop a bomb on Hiroshima and Nagasaki?
What does that have to do with anything?
It's
I was
scientific.
talking well, no, that's wait, no, that's a moral question. You asked a moral question. How was it wrong? I'm not. Are you trying to say that a nuclear bomb didn't go off in Nagasaki? Because I can
Not at all.
factually tell you, yes, a nuclear bomb went
You're
off.
mentioning moral things too, like not having children.
No,
Oh,
I'm not.
you can't have children and all this stuff, and everyone's saying that
That's
it's
not at
wrong because
all.
you're
We're
not having
talking
children.
biology.
That's not at all.
We're talking.
You literally
Matthew, are
said,
you
"Is it
listening to this
wrong?"
conversation?
Yeah, Matthew, listen to me. Listen to me.
Mm,
I made the
listening.
statement. What is scientific about being trans is that for Bryn and I, our lived reality for us as trans people, just us individually here,
Mm.
scientifically, medically transition to better feel our gender identity and live and thrive as trans people. That's what I said. I didn't say is it wrong or right.
So,
I
so
said, is that science?
you said something about being wrong, if I'm not mistaken. You said you said a lot of people say that it's
Some
wrong what you're doing.
people will say that it's wrong because they believe it's
Mm-hmm.
anti-science to do what we're doing.
Ah, okay, I see. So it's not because you can't have children or anything like that, because it's anti-science, they're saying it's wrong.
Yeah, they're saying it's wrong because we are manipulating our natural bodies, which
I
is
mean, no,
scientifically
science
engineered
is
to be
definitely
perfect and
involved in what you're doing.
exactly. So how is it
I'm just trying to
anti-science?
figure out what I am saying. Like, for example, I don't believe I believe there's something in your mind that tells you that there's a mismatch. I don't believe this mismatch between gender identity and sex is scientific. And
What
so
do you
that's
mean?
kind of where
We're living proof. We're living proof to show you that that is not correct.
Yep.
how are you living proof to show me that that's not correct?
Because my gender is woman, and my sex assigned
Mhm.
at birth is male. I'm not denying that. That's
How
what
can you
makes me a trans
scientifically
woman.
show me that your gender is woman?
How do you show me
My
your gender
gender
is man?
I don't think that's a matter of science. You're saying it's a matter of science. I don't think it is.
so wait a minute.
Matthew, listen to me. Matthew, so we
Mhm.
have examples. We have case examples of people that had botched circumcisions and then were
Mhm.
had their sex assigned to be female after that through surgery because of the
Mhm.
technology at that time. Those people
Mhm.
demonstrated gender dysphoria because what was in their brain didn't match their body, even though they were raised to be a woman after that because of their
But their
anatomy.
body was male.
So
Their body was male.
Matthew, I have a question for you. Hold on. I got a
Yes,
question. Do you have a consciousness?
please.
Are you conscious?
I am aware. Yes, I'm conscious.
How prove it to me?
I can't scientifically prove it to you.
You can't so are you saying because it
Unless
doesn't
you're
because you
telling me
can't
that you can.
scientifically prove it doesn't mean that it's not scientific?
Not
Are you saying
necessarily.
that
I'm
your
just saying
consciousness
how is my
so
position
your
anti-science? What I'm asking you.
can your consciousness be studied?
To a certain extent,
So therefore it's scientific. There's a
correct.
whole
I
body of
guess, yes.
science that studies consciousness,
yep.
right? You can measure it. You can
Yeah,
understand
I
it.
mean
Just because you can't
it's not
identify
100%,
where its
but
origin is, it doesn't mean that it doesn't exist. Therefore, there is scientific proof that consciousness exists. even though we can't
I'll
put
give
our
you that.
finger on it. All right. So it's the
I'll
same
give you
thing with
that.
gender. It's the same thing with gender.
Yeah, but that goes deeper,
Why
I
is
guess,
that?
into the consciousness where we can't reach scientifically, at least not yet.
But can you not study gender?
You can, but I think for someone to say that I have this mismatch, there's no way to prove that.
So there's no way to prove you're conscious.
No, I think that's a little bit deeper, like we said. I will give you
Is it
that you can
deeper?
study consciousness
Because
to a certain extent.
yeah, so you can study gender in the same type of way
I just
because
don't see
everything is
how
involved
me
around questioning
disagreeing
the
with.
person, right, Matthew? Listen to this real quick. For me to study
Yeah,
your consciousness, I have to ask you a series of questions that you have to answer,
indeed.
right?
Correct.
For somebody to study my gender, somebody has to ask me a series of questions that then I have to answer. How are those two things different?
I would especially gender, which I agree with to a certain extent, is being a social construct. It would be a lot harder to do that. I don't think consciousness is a social construct.
Just because it's hard doesn't mean it's not scientific, right? You do realize that, shooting a rocket into space is harder science than flying a plane.
Probably, and you can go as far as to say just because I agree, just because it's not scientifically founded yet doesn't mean it's not scientific. I
It
I
is
can
it
give you
is
that,
founded.
but
We have scientific
pardon?
evidence that we have scientific proof that people have gender identity just like we have scientific proof that people have consciousness.
Scientific proof that people have gender identity. Well, I wouldn't say that's scientific. That's very subjective. Their gender identity.
So
Does
is having a
Matthew
conscious.
Matthew
I would
is
agree. Yeah.
that something subjective? Matthew, does
hmm
something being subjective mean that it doesn't exist?
No.
Okay,
Does something being
so
subjective mean it can't be scientifically studied?
Not at all.
okay.
Okay.
So then
So
where are we missing each other here?
yeah,
Why are you still arguing
because
against this?
Matthew, to deny gender is to deny the science that we understand that gender identity exists.
No,
That's
And
I don't
if
even
you're going to
deny
dismiss it,
I don't never necessarily just
well,
deny gender per se. What I'm denying is this quote mismatch between your gender identity and your sex signed at birth. That's where I'm kind of disagreeing with. That's where I'm anti-trans
But
at.
Matthew,
yeah, and again, Matthew.
I'm gonna blow your mind. I'm gonna blow your
hmm
mind, Matthew. Do you realize
Okay.
that the science of observing sex in biology is an observable science, exactly the way that gender identity is studied as an observable science? You study through the observation of something that already exists.
Such as sex.
You get that? Do you understand that?
So
Like it's the same scientific
what you're
principles.
saying is that we observe sex, we observe all the science behind sex, and we also observe gender.
Yeah, we observe
Mhm.
gender the same way that we observe things through scientific lens as well. We observe
And how do
gender
you
identity
how
through a
would you propose
scientific
that we
lens.
observe gender?
You ask the people just the same way we would observe your consciousness, right? You ask the
It's
person
similar
that's
that
having the gender. Go ahead.
there
Yeah.
are ways to study things that are subjective. And you even just agreed that there are ways to study things that are
Yeah, but
subjective.
the thing is, I think
And so that's
consciousness is a lot more if I may, a lot
it
more
doesn't matter what you
concrete
think,
than gender is.
Matthew. It doesn't matter what you think
Okay,
about that. Like
I'm
Yeah.
convinced.
like
I'm convinced.
you're choosing something to exclude from your criteria of other things because you don't like it.
Matthew, are you trying to
None of,
say that your
not,
gender of man is not as established as your consciousness?
um, my gender of man is not as established as my consciousness.
Yeah. So are you kind of
Yeah,
like, I
yeah.
don't know if I'm a man? Are you like that? Are you like,
No,
I
no,
don't know
no.
if I'm a man, but
Yeah.
I know I have a conscience?
Like I said, I can. We all have consciousness, right? We all have
Yeah,
consciousness.
and
We can
we all
all
and
attest that we have
do you
consciousness.
and we all have a gender, most of us, right?
No, some people are
Would you
non-binary.
say that?
Some people are
Well, yeah, that's a
non-binary.
gender.
Some
Some
people don't
people, that's
identify
a
with any
gender
gender at
identity
all.
for people. I know some people don't. Like I said, most people. That's why I said most people identify with the gender identity, just like you identify with the gender identity, and you identify of having a conscious. So your gender identity is just the same as my gender identity because we both have it internal to us. And the only way I know that Matthew is a man is by asking you.
No, I mean, this is where
Yes.
this is where I feel like there's the anti-science. It's like, oh, all you gotta do is ask someone if they're a man, and they say, yeah, I'm a man, and they're a man. And so basically,
Matthew,
somebody can just say that they're a man and they're a man.
Matthew.
Okay, let me ask
Hey,
you this,
Matthew.
please. Go ahead.
No,
Matthew,
Go
let me
ahead.
ask you a
no.
question. Let me ask you a question, Matthew.
Okay, sure. I thought you said let me hear your question. I
How
was
do
like,
you
wow.
feel about
Mhm.
how do you feel about studying pain and treating pain? Should we give people
How do I
medications
feel?
for pain? Should we treat people with pain? If someone
That's actually a really good
comes
question.
to the
I appreciate that question. Give me a moment because I appreciate that
if someone
question.
comes to me and says
Um,
if someone comes to me and says I'm in pain, should I say no,
uh-huh.
you're not, and just not help them?
Like I
Prove to
said,
me that you're in
that's a really
pain.
good question.
Prove to me that you're in
That's
pain,
a really
Matthew.
good. That's a
Yeah.
really good question, and I want to address that because that's kind of to where my point is getting. There is a lot of that's in the field of pain. You actually have people that will claim they're in pain and not be in pain for obvious reasons, right? And so that's where
Most
things
people
get
don't, though.
challenging, and
Most people
you can't
don't.
scientifically prove.
So
I understand, like
Matthew,
the smiley, sad face. You can't
Yeah, so
scientifically
answer
prove that
the
somebody's in
question,
pain.
hold on,
maybe.
hold on, Matthew. Hold on. I got
Mhm,
a question for you.
mhm.
I'm gonna put this
Oh
in
boy.
front of you, right? Because
Mhm.
some people would use that exact same reasoning on, like, okay, so for example, some people will lie about having pain, and some people will use
Yes,
that logic to say, you know what? We're not going to give pain medication to anybody because somebody could lie to a doctor and say they're in pain. Is that an absurd
that's silly. Yeah,
position?
yeah,
Okay.
it's absurd.
So isn't it
Um,
absurd?
mhm.
Isn't it equally as absurd to say, "Oh, some people may be lying about being trans, so therefore we shouldn't let anybody be trans." Is that an absurd position
I
too?
mean, I'm not in charge of letting anyone be trans or not letting anyone be trans, but I did want
Well,
to
there's
address
some
the
governmental
pain thing.
organizations and laws that want
I'm
to do
sure
that though,
I'm not a
right?
part of the government. I
I
am, but
know.
I'm
So
not
I'm just
that part of the
saying
government.
that
Matthew,
you
Matthew,
can't
so now that we
dodge
backed you
it.
into a now that we backed you into a corner, now you're saying that you don't have the ability to speak on this subject. So then why are you talking about this at
No, no,
all? Like
no,
if
no,
you're
no,
not
no. Let me breathe a little bit. Let me get some space. I really like your
Okay.
pain
All
question.
right.
okay.
Yeah, I really like your pain question, and I wanted that's kind of where I want to go to, because we can all scientifically, at least to some extent, where I'm giving you, Josie, you said we can scientifically say that we have consciousness, right? Some will argue.
Yeah.
I will be willing to kind of concede and say we can prove that we have a consciousness. It's hard for me to say that, but I'll give that. But to say that we can prove that somebody has a pain, that's a tier harder. That's what I'm trying to get with gender. Gender's a tier more challenging than pain or than
No, it's not.
consciousness. Would you agree with that?
Oh, then consciousness.
Why
Yeah,
is
it's a tier more
consciousness so
challenging.
Why you're
easy for
phrasing it that
you
way?
to
Can we?
understand?
Yeah,
Yeah.
can we go to pain? Let's use pain as our analogy here. Like I don't want you to fumble around
Please.
with this. Like I want to get to the meat of this. Like
Yeah.
what's your position on that? If why shouldn't we treat transition the same way that we treat pain?
Do we? I mean, I'm not even sure the way we treat pain is the best way we treat pain, right? It's like I said, you
Because you
got
know
people
so much
who
about
claim to have
medicine.
pain so they can get
Because
Matthew,
opioids.
Matthew, you
What?
tell me right
Matthew,
now. Let me. You break your leg
no,
and you're screaming in agony
Mhm.
and pain, and then somebody gives you morphine. Are you trying to say that that pain reduction isn't real?
I mean, my leg is broken, Josie. Let's do something a little bit different,
no,
right? Let's do fibromyalgia.
jump in here. Let me jump in here,
Let's use
Matthew. Because
let's use fibromyalgia. Oh,
Matthew,
sorry. I thought I was
are
talking. Please,
you
please.
Matthew? Are you a medical practitioner?
I am not.
Are you trained at all in the practice of medicine? and prescribing medications?
No, I am not trained in prescribing medication.
Would you accept the burden of making the decision for what medication somebody needs or what they don't need?
I'm not even in that practice, so I don't need to even worry about that.
Cool. So your opinion, like, on what we should change or not change about the practice of medicine and how we deal with pain, irrelevant because you have zero training in this. You don't do this. I do. So I'm going to pop in and say this. So, do you think it's easy to tell who's faking pain and who isn't? Do you think
No,
it's
it is
even
not.
reliable to guess? Do you think it's even reliable at all to guess? Do you think it's reliable at
even.
all
I
to
mean,
guess if somebody's faking or not?
If we get Josie's example of breaking the leg, I'm going to assume somebody's in pain.
Okay, let's say,
Sure.
like we got some more nuanced examples though. Let's say somebody
Please, let's use those.
looks like somebody looks like they feel fine. They look like they're not. They don't have any trauma. They don't look like there's anything wrong with them, except they are saying that they're in extreme pain. Their emotions are telling you they're in extreme pain. What's your move?
Well, like you said, I'm not a professional in that, but like I said, that's
exactly. So you're saying, so you're saying
this
that.
is what I mean by proving
No,
my point.
Matthew. So you're saying, Matthew, shut up.
I don't think you're
Matthew,
doing what you're planning on doing here.
Hold on,
Matthew,
Matthew. Hold on.
Shut the
please,
fuck
go
up,
ahead.
Matthew.
This
Okay. So we know when we're talking about pain. We good. So we know when we're talking about pain that it's nuanced and there's a lot of responsibility and a lot of consequences if you're wrong in diagnosing and treating somebody with pain, right? We understand that. I think you understand that. There are plenty of conditions, especially things involving the abdomen and the peritoneum specifically, where we call it pain out of proportion to the illness or to the condition. Another one like that is compartment syndrome. Like these are medical emergencies, medical and surgical emergencies, where if you have this, like you are going straight to the OR, like do not pass go, you are getting emergency surgery because it's an oh fuck situation. But it is pain out of proportion. Like this somebody, like it's something that if you lightly touch somebody and they shouldn't respond, like, and they are screaming in agony, a lot of people would say they're faking it. But a lot of people aren't. And somebody has to be the person to make that call on who gets the trip straight to the OR, who gets the medication, and who doesn't. And that burden falls on me. It falls on other people in my position. And it's a very, very heavy burden to take. The same burden happens with trans people. That's the same situation. And so when we have people who are not trained at all, like we recognize that a lot of people are not trained to give out pain meds, and they know that there are consequences with getting that wrong. That's the same thing with trans people. There are consequences to getting it wrong, but there's a lot of benefit and a lot of legitimate reasons to do it because most of the time we get it right. Like managing trans people is a lot easier than managing people with really any kind of pain. Like pain is hard. Pain is hard to manage. But with trans people, like if you have an experienced clinician that knows what they're doing, like it's like from my training, it's not that hard of a thing from our side to manage. And so when we have enough data to reliably make the right call over and over and over again for all of these patients and a wide range of practitioners, many different practitioners across specialties can do the same thing, and it repeats itself with the same statistics over and over and over again. It's pretty reliable at that point.
Yeah,
and so
science.
like having somebody like you that's saying that it just doesn't sound right to you that it works that way, like you're not in a position to be making that call like you're mentioning about pain. But yeah, this is science. You are seeing the scientific method unfold live, like in real time. And I hope that you can recognize that maybe you need to defer a little bit to the scientists that are doing this work and to the data that's out there. And leave, like, when you investigate this, leave your bias at the door. And also leave your Dunning-Kruger at the door. Leave your Dunning-fucking-Kruger at the door.
So, Dr. Ben, we also have detransitioners. We have people who say, "Hey, look, I wasn't.
Yeah,
I just
we
needed to have
do.
a conversation."
We do.
Yeah.
Yeah,
So,
but
And it's
like going back
and
to
we
the
try
pain,
to treat
Matthew.
those people.
Yeah, going back to the pain example, like if I'm wrong about giving someone the pain meds who didn't need them, like does that mean that we should deny it for everybody?
no, that's not what I'm saying at all. I'm just saying that we were
But
going
that's
down
what
a
people
path.
Right.
use those.
So
So
the
why
I'm
so
bring
not
up
the
that person.
detransitioners?
You're talking about people use. You guys keep saying that. That's what people say. That's what someone said. I am not that person. I am not someone who's
so
saying
why
that
are
at
you
all.
bringing it up? Why are you bringing up
So why did you
detransitioners?
bring up detransitioners? Yeah, what was the purpose of bringing them up?
Because we're talking about how complicated pain can be and getting it wrong, and we're also talking about how complicated gender could be and getting it wrong.
Yeah, and do
Yeah,
you
and
realize that more people
sometimes
get
people
pain
do.
wrong than they do get
Yeah.
trans people wrong, right? You do realize that the detransition rate is so minute compared to misdiagnosis of pain leading to people's death. I'm
Yeah.
right. Am I right
Well,
about
just
that,
because it's a
Ben?
minority group, and just
Just
because it's a
making sure
minority
I'm
group
right
doesn't mean
about
it's
that.
irrelevant.
Yeah, and here's the thing. There are
Yeah,
risks with anything. And the thing is, there's a whole conversation that happens with patients before we start transition, like medical and surgical
yeah,
transition. We have these conversations. And that's what, like, people say that all this stuff is happening just without the process of medicine that happens behind the scenes. But like, this is the work that I do. And I don't just give people prescriptions without having a visit with them and without evaluating the situation. You have the conversation and you say, hey, like based on what we're talking about, these are your options. These are the risks associated with the options. What is your choice to do? And that's up to them. Like
So,
there is some shared responsibility there, but the patient gets to have control over their body in that moment. And there are times when people do the thing that I wouldn't necessarily do for myself, and they get to accept those consequences. And sometimes they're heartbreaking consequences, like not specifically related to gender, but related to even JWs that refuse blood transfusions. Like I've seen that go wrong. But you know what? They have the right to make that choice. And so,
yeah.
but this is even more like reliable and that it's even safer than a lot of the things we're giving people control over. And
so
Yeah.
let
we're
me
regulating it a
clarify
lot more
something.
than other things we're giving people control over. Like this practice is so incredibly regulated. And I don't know if you understand that. Like the people that are detransitioning, it's such a minor population and they are important. But that's why it's important that we keep doing this the right way. It's not an argument for not doing it at all. It's an argument for continuing to learn and developing the guidelines to best rule in people that need it and rule out people that don't. And that's something that's the art and science of medicine that goes forward.
So let me clarify for something where I was trying to get at in the beginning. Going through the APA, going through Jack Turbin, and even someone that is again, which is weird that I'm saying this because I guess it's not even my side because I dropped everything. I think I maybe even leaned a little bit more to the trans side. I just dropped everything and I was just like, let me just come at this clean slate as much as I can, right? You can push your biases aside, you know how challenging it is. I believe you can. And as I looked at it, even looking at Jake's book, the people he was talking to and the information that he gave, it just seemed to me that wasn't enough, or at least like scientific in a sense. It was more
What
subjective,
wasn't
like
scientific?
pain.
What wasn't scientific enough? What wasn't?
Yeah. So the idea of just
Matthew,
someone
what wasn't?
saying,
What specific thing? What specific thing wasn't
yes,
scientific enough for you? And I
yes,
think you mentioned it earlier on in the stream. Um,
yes. The idea. Okay. Are you
what
done?
point was
Am I
not
done
convincing
already?
for you? No, Matthew,
Yes.
what point was not
The
convincing
idea.
for you?
Oh, yes. Can you hear me?
Yep,
Yes,
we can
we're
hear you.
asking you a question.
Okay. Sorry, I was trying to answer. the idea that somebody can say in their mind that they do not feel that the gender assigned at birth, they do not feel the sex assigned at birth. They don't feel they feel that as a mismatch. They feel a mismatch. That's what I found
You
to
keep
not be
going back to
scientifically
that
founded.
point, but Matthew, when we give an intervention, and those people get better, and we do the same thing for the people with the same symptoms, and we do the same intervention and they get better, and we do that a few 100,000 times and even more than that, and we have like pretty much the same results across the board with like a few people that had different results. That is a study, right? Like, we have demonstrated that this is a management protocol that is effective for people.
Yeah.
And
I
it's
want to
okay that
push
you, and
back.
it's okay that you don't understand it, but we
Are you
have the
sure it's
data.
okay
and
that
I
I don't
just
understand it?
I mean, listen, Matthew, listen to this real quick, okay? Do you
Mm.
realize that and I'll say this is like you're using one line item and Jack Turbin is a cis man. I know Jack. I've worked with him on research before on in things. And one of the things that I will say is you're using somebody's understanding as a cis person saying there's a mismatch between somebody's sex assigned at birth and their gender identity, and you're saying I don't vibe with that. But you realize that that is one way of explaining the data set, right? The data set, which is thousands of trans people, and even on the US trans survey, almost 100,000 trans people saying that their lives are better and they have a better quality of life when they receive transition related health care and if they receive gender affirming surgeries. That is what I look at as a trans person. You realize that? Like you realize how much internalized homophobia and transphobia I had before I came out as trans? I was raised as a Texan. I was born into a Catholic household that later became Pentecostal. I have been through the ringer. I was in the military, and Matthew, you know how transphobic the military can be, especially 10, 20 years ago. Like, this is the reality that I had to live with and I had to fight all of this stuff. And it was the data that I saw that said, you know what, it's okay to be trans. I'm going to be okay because so many people have been through this process that have very similar like experiences that I'm dealing with right now and have come out and thrived afterwards. And I took that risk. I took that risk to take that health care, right? Because everybody goes through a risk when they go into a doctor's office and they make a decision about their body. It doesn't matter if you're going through a knee surgery. It doesn't matter if you're going to cardiovascular surgery. It doesn't matter if you're going to cancer treatment. You are going in and you are risking your life by making those decisions. You are risking your quality of life when you make these decisions. And all you got to go by is the data. And as somebody, Matthew, you are a person that doesn't have to deal with the medical condition that is gender dysphoria that I had to deal with, that Ben had to deal with. So when I went through that doctor's door, I already had a notebook of questions of what I needed to be able to do to be able to have a successful transition through a scientifically case studied standard of care that is approved by the effing globe before I even let that first pill go into my body. So you have to understand that my perspective of my transitional healthcare, just at a personal level, and what I had to know before I had to walk through that door, may be a little bit less in depth than the skin deep understanding that you have of transitional related healthcare. So when somebody comes and tells me that being trans is anti, or trying to tell me that being trans is wrong or it's not medically safe and it's not okay, yes, they're anti-science because I have proof of getting healthcare that saved my life. Right. So that is why I
Let
think
me
we
ask
get
you
a
this.
little aggressive on these calls, Matthew.
Let me ask you this, Josie. Scientifically, what does sex have to even do with gender?
Because I'm
You are
trans.
just avoiding Matthew. You are avoiding this whole conversation. Where
Yeah.
No,
you are
I
just,
heard
did you
you,
even
and
listen to
that's
Matthew, did
why
you
I'm
listen
asking
to
you a
anything that was
question.
just said? You didn't listen to
Yes,
anything we
you
just said.
went through a lot of
Because
distress.
you
I
have to
went.
realize, Matthew. Hold on, Matthew. Stop for a second, okay?
Please go ahead. No, please go ahead.
You and I have had many conversations about the difference between sex and gender, okay? But when I was talking
hmm
about my medical transition, which is 100% based on my biological makeup of who I am, knowing that I had testicles and I had high levels of testosterone, I knew that I needed to turn those things down in order for me to live my best self as a trans woman. I am not sitting here telling you, Matthew, that I am a cis woman. I have been telling you, it is the Transatlantic Call-In Show. And if it's a surprise to anybody, hi, everybody. I'm Josie, a trans woman, a person whose gender identity does not align with their sex assigned at birth. I had to take medication because I was born with a fucking penis. Does that make sense to you, Matthew? Is that more clear for you on how it has to deal with my gender identity and biology?
So, and I hear what you're saying, and exactly what I'm asking. This is why I knew that's where you were going. That's why I asked the question. Scientifically, what does sex have to do with gender?
Because I'm trans. Because I wanted to identify as a trans woman with gender dysphoria. I wanted to be more aligned with my hormone profiles. I had facial feminization. I had bottom surgery. I did all of those things through a scientific lens for me to better fit in my social construction of what I want to be as a woman in society, which is gender. We've had this conversation before. That allows me to live this way, look this way, and be this way compared to what sex I was assigned at birth. Do you think I just ignore the fact that I was born a male?
No, I'm not asking that at all. All I'm asking is scientifically, because I'm trans is not necessarily an answer for me. I don't think that's a scientific answer. Scientifically, what does sex have to do with gender?
Because my gender doesn't align with my sex assigned at birth. I'm not cis. That's how
Why
it
is
makes a difference.
sex and gender scientifically? Why is sex and gender correlated?
It's correlated in this specific way because I have gender dysphoria and I want to medically transition. That's why. Matthew, do you realize that I am confronted by the biological reality that I was assigned a male at birth? So therefore, I had to take specific hormones and specific procedures to deal with that in order for me to be happy as a trans woman. Do you believe in that reality?
I believe that, yeah, to a certain extent, I believe what you're saying, that you felt uncomfortable as a male, so you
Yes.
decided you wanted to become a woman.
I didn't decide, but I just wanted to
Matthew,
live as the person that is my identity.
Matthew, do you understand that sometimes you need to change what your body is doing in order for you to be healthier?
Yes, I definitely know that. That is a fact.
Right. So this is an example where you have to change what your body naturally does in order to be healthier. Because
Do
just
you
because
have
something
to?
is natural doesn't mean that it's beneficial. For a lot of people, yes. For a lot of people, they do.
What happens if they don't? What happens to their body if they
What do
don't?
you mean? What do you mean? What happens to their body if they don't? You talking
What
about what
happens to
happens
them
to trans
biologically
people?
if they do not? Yes,
Are you talking about
if they do
what if
not, if
they can
Do you
go through
think that,
psychological distress and take their own
yeah,
lives?
so psychological
That's
which
distress.
is
pretty
an
I'm
clear.
talking about
emergency?
is there anything biological that will happen to somebody if they do not transition? Let's say, for example, they go to cognitive
Matthew,
behavioral therapy.
Matthew,
Okay,
Matthew,
yep, here we go.
Matthew,
Yep.
No,
Matthew.
that's called
If
conversion
you
therapy.
if
We have
you if
science.
you if you unalive yourself, is that not a biological thing that you do?
The unaliving, yes, is is a biological thing.
Right. So we can
What
prevent
led you
that.
to
Would you like it if we could prevent more of that? We can
I'm just
prevent
talking
it
about
very
myself. For
easily
me,
for a lot of people.
for
Yeah,
me,
for a lot
for
of
me,
for
I'm answering your question, Dr. Ben. It's important that I answer your question.
okay.
For me, if it caused me, and this is just me personally, if it caused me to live in a way that wasn't that was affecting other people, that was how do I explain, that wasn't really connected to reality, I probably would not. I would probably want a different type of protocol. I wouldn't want any kind
Except
of medical
Matthew,
transition.
that is not no, that is a straw man. And
Actually, no,
that's
no, no.
multiple fallacies
Okay,
in one.
I'll
It's
still man
great
it. I'll
because
still man it.
Matthew,
Hold on,
because
please.
no, shut up,
Okay.
You
shut
had
up,
an opportunity.
because
Hold on, let Finn talk.
do you think
Yeah, sure.
that is more important for somebody to be comfortable with you than you to be alive?
Well,
Do you think
it
that that's the
really
case?
does depend. For me personally, I'll
Answer
use
the
my own
question.
personal
No, no, no,
experience.
no. You
Answer
can't
the
walk away from
question,
that.
Matthew. Answer the
I'm not
Answer the
walking away.
question.
question.
I'm walking into it. For me personally, I have a condition where I do not take medication for. That I'm sure if I did take medication for, it would lessen the risk of me unaliving myself. But I'd rather not take the medication because I don't know what it will do to me, and so I'd rather have the risk of
That
unaliving
is
myself and not take the medication. Personally, for me,
That's your
Matthew, and that
choice.
is a risk. That is a risk
what I
that
just
you
said.
choose to take for yourself. Do you think
That's what I
that
said.
you should mandate that choice, Matthew? Do you think you should mandate that choice for other people, or should they be allowed
No,
to take that medication?
I'm not in the business of allowing or mandating anything.
So then, why the fuck are you trying to even say anything at all about trans people? If taking that medication reduces the chances of them unaliving themselves, and it has certain biological effects on them, kind of like we're saying, if they say it is more worth it to me to have those changes and be alive, shouldn't that be their decision to make?
I'm sure it is their
And
decision.
shouldn't we support them in that decision?
I don't have to.
Yeah, but that's
an ethical
like
question, not a
Matthew.
scientific one.
And you can
Yeah.
have that thought, but in my opinion, that's a really, really shitty thing.
That's
Because
your
what you're
opinion.
effectively saying, what you are effectively saying is that people who are trans are better off not alive.
Okay, that's what
That
you
is
want
what
to say.
I'm hearing from you. That is what I'm hearing from you, Matthew.
Alrighty.
That is your
You're
position.
essentially saying that. You are essentially saying that, Matthew. You need to rewind it back and listen to that because I think that's very, very important.
I think they benefit from alternative form of treatment, and I think the whole
They
But we
don't.
already
They
know
don't. They
scientifically.
don't.
I would really
We
like to
don't.
finish if it's possible.
Conversion
I don't
therapy
have to.
increases
That's
risk of
it's your
suicidality.
show. I
Matthew,
don't have to,
conversion therapy
but I would like to
increases
finish.
risk of suicidality.
Yeah. Period. Point blank.
The
So
Like
only
that's why
thing,
conversion
the only
therapy is
thing,
banned.
the only
for
thing that
me,
is
that is
effective, the only thing,
that is
Matthew,
called passive
per the
aggressive
data,
terrorism.
Matthew,
I'm not interested.
per
I'm
the
not interested in
scientific data,
being terrorized.
You're not being
Matthew,
terrorized. You're not the
you can
victim.
take your,
Like
yeah,
we've
you know what,
literally
Matthew?
had a whole hour-long
We're done.
conversation with you.
I'm done with you,
Yeah,
Matthew.
we'll call back
You
later.
don't,
Oh my god, I'm
yeah.
done. I dropped him. I'm sorry.
If you don't
It's like
value
to
human
me,
life,
like
yeah,
emotional terrorism. Now we are the terrorists when we're sitting here trying to
yeah.
say that conversion therapy is proven not to work. There is no other method to not being trans for a trans person. Like, get the fuck out of here with that. Like, we gave you so much room, so much leeway, and I understand that we were a little aggressive at the onset. But honestly, Matthew, we started asking you really interrogating questions and you immediately jumping around from one thing to another. Once we pinned you into a corner about a point you didn't want to talk about, you immediately went somewhere else. Even with the stupid question about how my gender relates to my sex. Like even with that stupid question, when I actually just laid it out as fucking basic as fucking possible, you decided to be like, oh, I'm gonna ask something different. Like you like fuck off with that shit, man. Like it's like so fucking frustrating. it's like, oh, anyways, go ahead, Ben. I'm just like,
Yeah, it's just if you like, we got him to say the quiet part out loud, which is
yeah,
unfortunate, but that's what it comes down to. That's what your position ultimately comes down to, is not valuing human life, specifically trans lives.
yeah, and that's
And
the
if you don't
science,
value
right?
trans lives, if your position is that you don't value trans lives, that's a position you hold, and I will adamantly oppose that. Um, and it shows us who you are, and you shouldn't call yourself like a humanist in really any form if you have that kind of stance.
Yeah, it's like the understanding, it's like we have scientific evidence to show this, that there is no other way to better serve mental health conditions of trans people who are in distress. Transition is one of the best methods to bring that suicidality rate back to as high as a cis person. We have the scientific proof to show that. And if you are anti that position, which is an anti-trans position, you are anti-science and you're also pro people taking their own lives. And that is how it goes. And if you want to say that's terrorism because we're trying to say that's the position that you hold, just because you didn't say it out of your mouth, but logically that's where you got to, I'm sorry. That's what it is. So, anyways, we have 2 more callers. Make sure to put in your super chats. Hashtag Team Ben, hashtag Team Spicy Josie, hashtag Team Spicy
And
Man.
we'll take a deep breath before we lower our
Yes,
blood pressure
yes.
a bit before getting
Whew.
into these.
And like a subscriber, Jimmy will have to go on a polyamorous dating show to win some prize money.
Wait, I want to do that. So also hit like and subscribe, and then go to patreon.com/calltheline. I was trying to make you laugh and ruin the take. That's why that silly face earlier. If I was on a polyamorous dating show, I would just choose everybody. Except Frederick. Leave a comment.